In this video, I'm going to demonstrate some simple techniques to release several muscles in the neck that can become very tight from computer work. So we'll start with the neck extensors. A good way to start is by palpating along the midline of the neck to find the spinous processes, which are bony attachment points for many of our muscles and ligaments in that area. Once you identify that, you can just come off onto the sides a little bit, and you can start to feel many of the extensor muscles as they run from the upper back into the neck. So basically, to stretch and release these muscles, we're going to have the person look up to shorten the muscles, and then we'll gently pinch them while they're in a shortened position, and then have the person look down while we hold that. You can use the other hand to help guide them a little bit, but they're going to do most of the work. So what I'm going to do is I'm going to do this section by section, and what I'm doing is I'm just moving up one finger width at a time along the neck, trying to capture the different sections of the extensor muscles. I'll move my way up with each pin stretch, and then I'll move my way back down. So how long should you do this for? I would spend about 2 to 5 minutes doing this to help the muscles relax. You may be wondering about pressure as well, as tolerance can vary with people. Hard pressure isn't always the best, as it sometimes can make things worse, so it's better to start light and then increase your pressure based on the person's tolerance. It's also better to spend more time with lighter pressure than be quick with hard pressure, as that can sometimes make the issue worse. One of our treatment philosophies here at the clinic is to spend more time addressing the issue thoroughly to provide the most optimal result. So now we're going to move up to the suboccipitals. It's going to be similar to what we did with the neck extensors. With the suboccipitals, you're going to feel along the back midline of the skull for a bump. Then you'll drop down a couple of finger or two width into a valley, and that's where you'll find the suboccipital muscles at. You'll use a pinching type of grip and push into that valley, and you'll be right over them. You'll also end up palpating some of the other larger extensor muscles that overlie them, and that's okay. Don't worry about being too specific about the suboccipitals, as it can be hard to feel them individually due to like fat or skin or just overly developed neck extensor muscles. So a couple options you have: you can place one hand on their forehead to support their head, and then using a pincer grip to push into these muscles. And again, you aren't squeezing super hard, but what you're trying to do is push into these muscles slowly and repeatedly to goad them. You'll stay mostly in the same area, but you can move around in really tiny circles. Sometimes it helps to visualize them while you're working on them, and I have the picture up for you right there. I would spend a couple minutes at least working these, and again, if the person can tolerate it, you can push with more pressure, but it's better to utilize less and do it longer. So if you want to, the other option you have is to take your thumb and push into one side at a time, as opposed to trying to do both at the same time. In this case, your other fingers are used mainly as support while you goad with your thumb. So these techniques should help you address the backside of the neck. Let's talk about 3 other muscles that are common areas that often get lit up when patients come to see me. The first one is the levator scapula. That muscle essentially runs from the upper corner of your shoulder blade into the sides of your neck. So this muscle, what I find clinically, is that it gets really overactive when people work in front of the computer, because it can step in to help support the head. Sleeping on it can sometimes set it off because it is overly stretched, especially if you're sleeping sideways. And so this is like 70% of my acute neck pain cases, because they're coming in because something is going on with this muscle. But what I'll also usually see too is that when this is lit up, the upper traps are lit up too, as well as the scalene muscles. The scalenes are little triangle muscles that attach from the first and second ribs up to the sides of your neck. And so the interesting thing about the traps is that some research studies have shown that as long as you're sitting in front of a computer, they're going to be more active just from you doing that. And that people often can carry stress there, causing them to get lit up as well. So I think it's totally impossible to get rid of this problem as long as people are working in front of computers, but this is where some exercises at least can help mitigate it, but that's not the purpose of this video today. I want to show you how you can do some release to these muscles. Also, with the scalene muscles, they're accessory muscles of inspiration, so sometimes if people aren't sitting with optimal thoracic posture, they can't expand their rib cage as well, so they're not breathing as normally. And also, if they're carrying a lot of stress, they may be bound up. So instead of breathing with the diaphragm, they may be sniffing the air to help them breathe, which can get these guys really tense from that. So the first one I'm going to show you is how to do a simple release for the levator scapula muscle. So what you're going to do is you're going to find the upper corner of the shoulder blade, as that's where the muscle attaches. Once you locate that, what I'll have you do is rotate their head 45 degrees to one side. Then I'll have them look up at the ceiling. And then what we're going to do is apply pressure with our thumb down onto that meaty feeling part where the muscle attaches to the shoulder blade. And while I'm holding that, I'm going to have them look down to the ground as far as they can go, and then release the pressure and return to the starting position. So sometimes if you're working on the ladies, their hair might get caught. So you might pull on their hair. Just be careful and move it out of the way if so. So we'll repeat this. How many times to do this for? I'll do this about 10 passes, then I'll take a break for a minute, and then do it again. And you'll want to be especially careful with this muscle, as too much or sometimes too hard can make things worse. So it's better to just start out lighter and ease into it more as they become more comfortable. And it's kind of hard to see in this video, but doing this type of work a lot, sometimes your thumbs can get a little beat up. So I'll use my fingers from the other hand to reinforce a little bit by applying pressure on the top of the thumb. So I'll do about 10 passes of that and then let them rest for a minute, and then maybe go work on another muscle for a bit, and then come back and do some more passes on it. Okay, so now we're going to address the scalene muscles. I'm not going to get overly complicated about them, but there's an anterior scalene, middle scalene, and a posterior scalene. Usually what I find is that the middle one is the most lit up, and oftentimes when the levator is lit up, it's the middle that's lit up too, and people have a difficult time turning or moving their neck very well because of this. So you got a couple options at your disposal to work on this muscle. Usually when it's lit up, you'll kind of have a little candy cane or a rod-like feeling under the skin, and patients will usually say something like, "Oh yeah, that's what's been bugging me." So what I'll usually do is I'll come onto the side of it with a little C grip with my hands, and just keeping my fingers tight and locked, and I'll do some simple, gentle goading to it, just really small semicircles along the belly of the muscle. If you take a look at the picture, the muscle I put up in the video, it'll help you visualize what you're working on. And what I'm doing is I'm just going really gentle and really slow semicircles over the belly of the muscle to try to get it to relax. You definitely don't want to jam on it or go super hard or fast, as that will light them up more, and too much can definitely make it worse. So just take your time with it. I'll spend a couple of minutes trying to release it just like that. So after you've done a couple of minutes to relax it, one thing I like to do is to stretch it out using a pin and stretch maneuver. Keeping your fingers over the muscle belly, you'll tilt their head to the side to shorten the muscle, and you'll feel that muscle slack a little bit as you bend more to that side. Once you get them to the side, somewhere between 35 to 45 degrees, what you'll do is you'll drop down slightly with your fingers toward the bottom, press down firmly with the finger pads to pin that muscle to its first rib attachment, and bend their head to the other side. I'll let up the pressure when they get to the end range, and then bring them back to start and reset. And so what I like to do is use 2 to 3 fingers, as it makes it easier to pin down the muscle and not be overly firm. Once you're fixated on the muscle, you can let them assist you with the stretch by tilting their own head away. And again, I'll do about 10 passes of this, let them rest for a minute, and do some more or move on to another muscle and come back. So the last thing I want to address is the upper trap. It's pretty easy for most people to find. And so Elizabeth already showed you some techniques for working on it in her massage video. Be sure to check it out with the link at the end. So what you can do for the upper trap, if they're sitting on a chair and you want to do some work on it, is you can use a pincer grip and bend their head to the side that you want to work on to shorten the muscle a bit, and then you can apply firm pressure and pinch it essentially with your fingers and thumb, and then have them move their head to the opposite side. Sometimes I'll use both hands on it, as this muscle can be very, very tight on many people. So again, I'll do 10 passes of this, and also be careful too, if they have long hair, you might pull on it a little bit, just move it out of the way. And so to remember to let up on the pressure as they get to end range, and then be set when they come back to the starting position. So there you have it. These are some very simple manual therapy techniques that you can use to alleviate neck and shoulder tension for your partner or family member at home.